to our Tgiaf. Thursday, April the 2nd. It is not April Fool's Day.
It is the Joyce and Debbie show.
It is. So, Debbie's doing most of it because thank God for Debbie.
But Joyce is going to dance.
Yes.
Get a pole.
And believe you me, I'm not having dinner tonight, but I probably should. Okay. Sign-in sheets. You guys did much better last week, but it's still effing. Because some people weren't here. Orange is nursing. Green is environmental services and dietary. And this yellow color is rehab. Please sign in on the right sheet. It really helps me. Last week I was able to put stuff in.
What
like
about
really
administration and MDS?
If you have a license, please sign in on the nursing. Debbie, you're the boss, and so you can sign in on anyone you want.
Oh, I don't think I've signed ever. You better give me credit, though. I think there's witnesses. Down here. Okay, all right, let's get through this. So then we can get our COVID-19 update for the day, or the week, right? In fact, I just got off, I've had 3 calls already this morning. Hello. So I've had 3 calls already this morning, one with the Florida Hospital Association, another one with the Department of Health, and the other one with the CDC, listening to all the latest updates on COVID-19. So before we get to there, we're going to do A-N-E. What does that stand for? Michael? Exploitation. Abuse, neglect, exploitation, and mistreatment. So what does that mean? Does that mean we treat them all like that? No? We don't? All right, maybe not. That's right. We shouldn't be treating any of them like that. So, give me examples of abuse. Sit your ass down. There you go. What else?
That's subtle and not so subtle.
Right? What else? What else?
Stopping a patient from moving their wheelchair.
Stopping them from moving a wheelchair. Isolating them, right? Isolating them without a reason. Now this is different right now. This is different right now. There are times right now where we might need to isolate a patient, right? And that is sanctioned by the Health Department, the Agency for Healthcare Administration, and by CMS. But that doesn't mean we can always isolate them. We can only isolate them if we're putting them under droplet precautions. Or they have C. diff and we need to isolate them for contact precautions. So, and if they're suspected. How about neglect? Examples of neglect. Not changing a patient. Not bathing them when they ask to be bathed, yes. Not feeding them, bringing their tray in and putting it across the room where they can't reach it. Not setting it up so that they can eat. What's that?
Waiting too long to answer call light.
Waiting too long to answer a call light, absolutely.
Walking past the call light without answering it.
Walking past the call light and not answering it, that certainly could be.
Someone asking for help and you just ignore.
Somebody asking for help and you ignore them, good.
You don't have pen? Anybody got pen?
What's that? Okay, so tell me what exploitation is. What does that mean? Taking advantage of them financially. Or, what other ways? Emotionally taking advantage of them. Can we date a patient?
No.
Thank you.
And you laugh.
You do laugh, but... Okay, and mistreatment. So what is mistreatment?
Basically the neglect.
All of the above, right? Anything. Talking rude to them. Making them feel ashamed that they did something. Or making them feel bad about ringing a call light. That's mistreatment.
Or having an accident.
or having an accident, or making them feel bad about anything.
Or going up to them after there was a complaint about the person.
Or, yes, or confronting them after there's a complaint about the person and they go up and talk to them. You can't do that. You can't mention it. You just gotta be nice. Right? Okay, so what do we do if we see any of this? What? And who do we report it to? Who's the abuse coordinator? And who else?
Jackie.
Jackie, there we go. But always call me too. You call me for everything anyway, so go ahead. All right. Now, and so when does it need to be reported? What is it? Immediately. So what does immediately mean? Right now, okay. Or within 2 hours, I have to actually make a federal report on the internet if there is any kind of harm done, if there's any kind of physical harm done. Within 24 hours, if it does not involve abuse and does not result in serious bodily injury. Right. So this is actually our regulation. So these are the definitions of abuse. And it doesn't have to be something that, what if they report something and we're like, oh yeah, she always reports that. What do we do with that? We still report it every single time. So, here are some common anecdotal things that they heard, that they have heard from employees, that they've heard from staff of nursing homes. This is directly from the surveyors. So an individual's allegation is not believed due to a history of reporting false allegations. This is like Chicken Little and the sky is falling, right? So how many times do we have to investigate their reports? Every single time. That's right. Even if they report it 10 times a day, we got to investigate it 10 times a day. We still have to look at it every single time. Staff fear of retaliation or fear losing his or her job. Is anybody afraid to report anything? Is anybody afraid of retaliation here? If you are, you can do it anonymously. Text me or whatever. Well, I guess that's not so anonymous. But give me a note. I don't know. Whatever you need to do. Tell a friend who tells me, all right, and says that they want, but we have to know. We definitely have to know. We don't want our patients abused or neglected. Or sympathy for coworkers, for example, not wanting to cause trouble for the coworker. That's some of the reasons that the state has been given by employees as to why things weren't reported. So it's very important that we report them. Or resident's representative may fear retaliation, so they don't report. We want to make sure that our patients feel comfortable here, that they don't fear writing the reports or talking to us. All right. There's one more thing in here I want to talk about. What is elder abuse? Now, there's another regulation. It's elder abuse, and it's specific to the state of Florida. That is a little bit different. So elder abuse is anything that's a crime in the community, we have to call the police on here if it happens here. So if the resident reports there's been a theft, even though we think it's been just lost, but they think it's been stolen, then we have to report it to the police. Because what would you do in the community if there was a theft? Report it to the police, right? Also, please, just recently there was an incident in Port St. Lucie where a patient had a stalker. Apparently the patient's daughter told the facility that the patient had a stalker. The stalker came into the facility in the middle of the night and smothered the patient with a pillow. So listen for things like that. If you hear anything like that, Dietary, housekeeping, hear anybody overhear it? What, we need to know about it. We need to know about their fears and what, because who knows, it could be true. And we need to investigate every single bit of that. Do we have any questions about abuse, neglect, and exploitation? Mistreatment. So the most important thing, if you hear it, if somebody complains to you about something being stolen from them, any allegation of abuse, even if you know, even if they say, you hurt me, what is it? What is that? Allegation of abuse. All right, so what happens? I have a lot of employees that fear what happens after that. So what does happen after that? Yes, you're suspended, but if it's unfounded, you come back with the pay. So you get a paid vacation. All right? So if it's unfounded and we collect statements, we collect your statements, we collect statements from the patient and any witnesses, anything from the cameras, the camera footage, and if it's unfounded, then you come back and there's nothing, no strike against your employment file, there's no strike against anything. You come back and you come back with pay. All right? So don't fear reporting these types of things. We have to report them. What happens if we don't report them? So the state could cite us. The state could actually close us down for something like that. They take those allegations very, very seriously. They could cite, usually they cite non-reporting as immediate jeopardy because they think that the facilities are trying to cover up something, or they don't have a culture of openness that we're trying to cover things up. So we want to be sure that everything that's reported, that we report. Everything that's seen, that we report. And you guys feel free to talk about it and to tell us about it because we need to do something about it. More questions? Does everybody feel like they can report things?
Yeah.
Okay. All right, good deal. Alrighty, so next up. We are under a statewide stay-at-home order. You guys are essential employees. You guys all have the letters. We have copies everywhere. So if you don't have it, and you also have it on your phone under Paylocity, so you can look at it under Community. All right. It's going to get worse before it gets better with the COVID. They're thinking that New York State is going to peak in the next 14 days with their massive number of deaths, and then they're going to start declining. Florida is a little behind them. They don't think we're going to peak for about 31 days. So the first week of May is supposed to be our kind of ground zero. They've started ramping up the calls. The Florida Hospital Association we're now publishing so that we can see their occupancy and they can see our occupancy, so we know if there's a surge in a certain area, they know where to put the non-COVID patients. So those are patients, anybody with any kind of signs or symptoms, they're testing and they have to have a negative in order to come here. The latest from the CDC today on the call was lymphopenia. Was the very earliest that they're seeing is an increase in neutrophils and a decrease in lymphocytes. So that's one of the 90% of the patients they're finding that's a common ground that they're seeing in the patients before any other symptoms appear. So watch your labs closely, please.
Say that again, increase in what?
Increase in neutrophils and a decrease in lymphocytes. Yes. Yes.
Do we have any patients currently positive?
We do not. We have none. And we're trying to keep it that way. Okay? We have actually tested, 6 employees have been tested within the facility, and all 6 have tested negative.
Yes.
Yes. That's good. Yes, ma'am?
When the peak comes as of May, whenever May do come,
Yes, ma'am.
let's say for instance, if the hospital is so overwhelmed with this
Yes.
in the villages,
Uh-huh.
what is the step that you want to take precautionary, not just the hand washing and all that? We already say 30 days stay home, by nurses and everything, it's a decision we have to be in. What is your precaution when it comes down to the peak? What you gonna do?
Okay, so right now, there's two things that are happening that are actually kind of exciting. I have 5,400 N95 masks will be here either between tomorrow and Monday. And I just got the tracking, so I haven't been able to look at it because I got it while I was waiting for you guys to sit down. So I'll know exactly when they get here. And those are N95 with the exhalation valves, and we will be using those all the time. We also have in my office, we have full hazmat suits, full face masks, full booties, coverings, everything. If we have anybody suspected, we are going to put them on droplet precautions in a private room right away. We need to know. You guys have been really good about letting us know, because we need a sudden onset of shortness of breath or coughing, and sometimes with a fever. They're finding with the elderly, they're going, a fever is above 99.4. A fever is not up to 100 anymore. It's above 99.4. So you'll see on your point-click care alerts that they're alerting us now for anything over 99 so we can watch it. All right.
Are you accepting any patients here with that?
We are not. No. That's why we're trying to closely screen. They have different facilities in the area that are designating COVID wings, and they're designated dirty. They will not release the names of those. I know who they are, but the Department of Health, they're trying to keep that very quiet for the press. They don't want that to ruin their reputations, but they do have a lot of empty beds, and they do have open wings that they can shut down so they can accept those types of patients. We do not. We don't have any open. So we will be the ones accepting if there's a surge. We're going to accept the patients that do not have. We're going to take the fractured hips off their hands. We're going to take the ones that have not been exposed, so that the hospital can just concentrate on the COVID patients. They'll be seen outside in external emergency rooms and then transferred directly here.
So how can we be sure they don't have it if it takes us 14 to 5 days, for them to come from the hospital? Because sometimes the hospital sends us stuff that we should know we don't know.
That's true.
And I'm speaking that because I can't speak for everybody else. I just have to speak for me and my family.
Well, with the latest news that the lymphocytes, the decrease in the lymphocytes and the increase in the neutrophils, I'm thinking we should do labs on day 1 now rather than wait, unless we have labs right the day before they get here. So that then we can identify patients that are early, that are asymptomatic, but have the change in the lab, because 90% of them have the decrease in the lymphocytes and the increase in the neutrophils. So that's going to be 90%. Nothing's going to be 100% with this disease right now.
So they're not testing them before they come?
They are testing them if they have symptoms, yes. They are testing, and we are getting the negative COVIDs before they get here. So if they have a sudden onset of respiratory symptoms, or they have respiratory symptoms, they are testing them before they come. But I'm thinking the ones that are asymptomatic. That's because the ones that are asymptomatic, the changes in labs occurs very early on, the initial viral load. So that's the body's first response to when the virus is introduced into the body. So then we'll be able to identify sooner. It's certainly, these are unsure times, but you guys are doing a great job out there. You really are. We're all in this together. We also, so the Family First bill that they put through excludes healthcare workers, but there's another caveat for healthcare workers and healthcare employers that have less than 500 employees, which is us. And so there is funding for bonuses for you guys that we're putting in for tomorrow morning. The window opens in the morning, and I have my form all filled out, and I have an accountant that's going to have his hands on the keyboard at 9 a.m. because the money does run out. But we're going to be first. I hope the system doesn't crash. We don't crash the federal government system. But as soon as I know something, I'll let you guys know something, and then we'll get some money into your hands for coming and being on the front lines and being here with us. I really appreciate it. Thank you.
That's that hazard pay.
That's hazard pay. That's exactly
That's what
right.
I was gonna ask.
Oh, is that what you're gonna ask? There you go. Yes, that is hazard pay. Most definitely. Now, they did say also on the CDC website, most of those who are end up in ICU, the vast majority have COPD, CHF, diabetes mellitus, some sleep apnea. So if you have sleep apnea, wear your CPAPs. But that's in addition to, so, and CKD. What's that? So chronic kidney disease. So we have, so those are the top diagnoses that these folks have that land in the ICU and land on ventilators. So it doesn't, most of the folks who are young and get it, and especially under the age of 55, very few have a lot of problems unless you have some of those other issues. Any questions? You guys know you're still being screened at the back. Also, oh yeah, and so we have masks being made. If you look online for UF Health, UF Health masks. So they developed a prototype mask that's made from the materials that you use in the autoclave. And they block 99% of the particulates. So the ones that, like Amy has on, that's an N95, which means it blocks 95% of the particulates. There you go. There you go. Model it. Good, good. All right. So those block 95% of the particulates, which does block corona. But the other masks block 99% of the particulates. And yes, you can still breathe in them. But so they block 99% of the particulates. And so we have right now 13 little ladies that are busy making us masks from those. Those can be, they'll also go on your baggie. They'll be autoclaved, and you'll have one that you wear and one that we're going to be autoclaving. So they're reusable, so we'll go back and forth for everyday use. And hopefully they'll be a little more comfortable than these and more effective than these. Okay? Yes, but yeah, they're all being made right now, and I can't wait to see them. They'll be shortly. As soon as we get them, we'll distribute. Yes, Sam?
You were saying about bonuses tomorrow. Suppose you have off.
No, you won't have bonuses tomorrow. Tomorrow, we're going to apply for the bonuses. We are making application tomorrow. He's ready. Yes, ma'am. Yes, Angelica. Yes.
Do we have to do anything, or is the accountant going to do everything?
No, the accountant. I filled out the paperwork with him last night, and so we're ready to go. We've got our finger on the pulse. We're ready to hit send.
So we don't.
You don't have to do anything. Nope.
Thank you.
Nope. We've done everything. We've already listed all your names and social security numbers and date of birth and everything. We're sending it to the government. Okay.
You know, is this catch-free?
I have no idea. You have to ask Mr. Trump that, okay? Tell him I want it tax-free.
Will this bonus stop our stimulus checks?
No. I won't have anything to do with your stimulus. That's right, hold on. No, those are two different programs. One won't have anything to do with the other. All right. Any other questions?
Okay,
Yes, ma'am.
get somebody to talk to someone like that being overworked and overstretched, you know, as it gets much busier.
Yeah. It
Like
will.
a counselor, like a grief counselor or somebody in here.
That's a good idea. That's a good idea. We will.
Okay.
Yes. Yes. And remember, you guys take care of yourselves. In this lockdown order, you know, this stay home order, that doesn't mean you don't get outside and exercise. Don't get outside. Get outside and go for a walk. Get outside and do something that's important to you. If it's getting away and listening to music for 30 minutes from the family, and I know all the kids are at home and they're all, you know, wild. So you can play golf, that's right. You can go ride your bike.
You can go play golf, you can't go fishing.
You can't go fishing?
They said you can't go fishing, but you can play golf.
Who wrote that? Okay, all right. Well, we need order, but go do something you enjoy. You guys have to take care of you, all right? Because you're important to take care of the patients that are here. We are a very integral part of the healthcare system, and it's you know, they are counting on us. You gotta stay home, you can't go fishing. But what about golfing? You said you can go fishing? Wait a minute, Jamie just looked it up, she said you can go fishing.
Thank you. They found it out where I'm at. They said no fishing.
The newspaper right there gives you a list of stuff.
There you go. All right, any other questions? All right, thank you folks, I appreciate you. Have a good day.